Good afternoon and good evening, everyone. Welcome back to our Patient Safety Project YouTube channel. And today we are at Naguru National Hospital, and we are glad to be here to actually learn from Naguru in regard to Kaizen 5S activities. And I'm glad to be here with the director. I'll request him to introduce himself and to give us a brief introduction of Naguru Hospital.
Thank you very much. I'm called Dr. Batiibwe Emmanuel. I am the director of Naguru National Referral Hospital. Naguru National Referral Hospital initially started way back in the 2020s as a referral hospital after having been upgraded from a health center 4, which used to be called Naguru Health Center 4. At this facility then, we got a grant from the government of Uganda that put up this structure, and it was effectively designed as a general hospital but operationalized as a regional referral hospital, which meant that the staffing capacity and the range of services were of specialized nature in the areas of medicine, surgery, obstetrics, and as well as community health and pediatrics. So these ones have been our mainstay for the past couple of years, until recently when the new mandate has been bestowed upon us, and we look forward to implementing it as a national trauma center.
That's great. Thank you very much, Dr. Emma, for the introduction about Naguru. Where, if I'm coming to Uganda today, how do I trace the location for Naguru Regional Referral Hospital?
From Google, using the Google Maps, we are located in Naguru Hill, Naguru Road, just behind the ShopRite, and between the ShopRite and the police headquarters. So that's where we are located. And this land is owned by KCCA. It's 3.5 hectares where we are located currently, although we look forward to expanding it once the National Trauma Center project kicks.
Okay, thank you very much, Doctor. Doctor, I want you to give us the importance of the involvement of the hospital management in implementing 5S and also Kaizen activities.
Yeah, this is an issue of leadership, an issue of governance. And you know, I have that old adage where people say that the fish rots from the head. So for us, without having a good head, we believe we can't have a good system, we can't have a good body. So we aim at ensuring that leadership is involved in quality improvement activities directly, by mainly going to meet the departments, by establishing systems like drawing an organogram which includes a quality improvement committee, by appointing respective heads of departments to this quality improvement committee, and ensuring that they are facilitated to meet regularly, conduct their improvement programs, and celebrate successes along the way.
Thank you very much. That's good. And give us an example. How do you celebrate the successes at Naguru?
Yeah, one of them is in case we put up, we do carry out regular support supervisions between the select committee and the respective departments. And they give us feedback and scores, which we look at and I will analyze and see how we can improve. Now, we can compare the different departments, and the department that performs well, we award them a gift in a certain giving ceremony where they are recognized and they are celebrated with together as a group.
That's good. That's really good and encouraging. So other hospitals, this is a good learning tip. And are there other tips that you want to share?
There is a 5S supervision committee which goes around and assesses internally the functionality of each of these departments as regards quality improvement. We also have peer support supervision, where the different heads of departments and a number of staff go in an interchanged way go to supervise each other using a standard checklist. We use this one in the sense that we know the various staff who are in the different departments are also being supervised by another group of staff from another department using a standard checklist. Now, it means that when they're administering this checklist, they're also revising on the standard. They're internalizing it even more. And so when they go back to their departments, they're able to bring on this experience back to ensure that they kind of model the behavior of the different staff they are within their docket, within their span of control, into ensuring that they carry out daily routine businesses into what the standards. Now, the other one which we also do is we have put up a daily checklist for the in-charges, which they have to follow to keep them reminded of what they're supposed to be doing on a daily basis towards quality improvement standards. So we are having these innovative approaches all in an effort to ensure that we promote the culture of Kaizen, the culture of continuous quality improvement. We also, on a quarterly basis, move around as top management to different departments. We sit with them and we discuss with them issues which affect the way they are handling their quality of care. And I think all these ones together, when they put them in place, we are able to promote that culture in the hospital.
Thank you very much, Doctor. Are there any tips other than these that you want to highlight to a hospital that is starting 5S and Kaizen, for example, Kayunga?
Yeah. We are in a situation whereby which we can share our experiences with other hospitals. We look forward to that again. We are looking forward to when we share some of the experience in terms of successes. We also motivate our own staff. By sharing them, we are actually celebrating successes, which I think is a very, very good approach to the way we are doing things. When we share this experience with others, also invite critique to see how better we could be doing our routine activities in this hospital. So for the other hospitals that are starting, I think it's very significant, first of all, that the leadership draws an organogram that has a quality improvement committee embedded in it and appoints preferably heads of departments into that committee, that they are responsible for the implementation of these interventions, of these projects in their departments that will lead into quality of care. That also them as the top management and other groups go routinely and share experiences at the department level. They get down to the department and listen to them and facilitate them, allocate them budgets to ensure that they are able to get the materials they need, get simple things like facilitation in terms of teas for meetings, stationery for their minutes, and feedback on a routine level. And I think also it is also very good that the head of the hospital, I meant that himself also gets physical activities. Thank you.
Thank you very much, Dr. Emmanuel. We really appreciate this time at Naguru, and we look forward to more interactions, even when we bring other hospitals to visit and benchmark here, because Naguru has had a lot of experience with benchmarking from other hospitals.
Very true. We as Naguru rose from the last position in terms of ranking of hospitals in the whole country in 2016. And we rose to the second best in the hospital in the country as of now, which is very good, I think. 4 years later, that's a significant achievement.
That's good. And so thank you very much for watching us, and we look forward to more interaction with your hospital as well in regard to other avenues of quality of care and also 5S and Kaizen. Have a good day.